In working with the community, one of the things is a lot of people don't know the wealth of resources that are out there. So they come to us, look, this is what I want to do. I want to work in such and such. I want to work in Hialeah, for example. Who's out there and who can help me? And so one of the things is we go over the strengths and the weaknesses of certain community partners and who would be good to work with somebody on a particular project. And then we often take it to the introduction. Some of it is coaching as well. When you go to a community partner, you don't know what is the right way to do it, how to approach them, what is it that's in it for them, why would they want to participate with you on this project, what it is that's helping them do what they do better, and how can it be a win-win partnership situation. And then we're also training resource. So oftentimes we get called to do a disparities lecture or a talk related to community-based participatory research with lots of audiences and groups, and that's something that our team is very experienced at, and we among ourselves, we divvy it up and decide who's best to do this lecture or this talk at which venue. But it's clearly one of the important resources is a training activity and teaching people about CBPR and health disparities research. And our partnerships are wide range. We have connections, particularly with the ethnic media. If somebody wants to do something with the ethnic media, we could introduce that. We have relationships with schools that we could help get into, and other community service providers. Oftentimes, we can also try to maximize and help people through those kind of relationships. As far as the actual research is done, there's a lot of times investigators come to us and just want us to review their forms and the letters that they're going to be using, and so we provide a lot of input into cultural appropriateness, language. We're not a translating service. We're not here to translate documents, but if somebody needs those resources, we have the links how they can get that done. Sometimes we actually give to the actual research study. One of the big challenges in our multi-ethnic community is how do you collect appropriate demographic information? If we go by the standard NIH criteria, we know that they're quite limited. For example, when we work with Black communities, here in Miami, it's not about African Americans. We also have many Caribbean Blacks, we have Haitians, so we give them some of the documents. For Hispanic communities, when you ask questions about race, many Hispanics are challenged, so we give them some samples of the ways we've done them that can work. And clearly for Latinos, you also want to develop place of birth or what ethnic identity, because subgroups are very important, and we could provide some actual feedback on that. I mean, some of the bureaucratic hurdles that we're very experienced at is things, how do you pay research participants? For example, we're undocumented citizens. It's very hard to find a mechanism without the social security numbers. How do you go around getting gift cards, for example? How do you do it in a way that meets all of our mandates for institutional oversight, but at the same time makes it easy on our study teams and research subjects? Many of those issues and many of those contractual relationships, many times a lot of the community groups don't know how to put a budget in the way that we understand in an NIH format, and so we help with that. We draft the budgets, we sit with them, and we work through them. And those are some of the things sometimes investigators may not be keen about, and that we help try to navigate those challenges that they face.